Hello and welcome to the very first episode of the Australian Miniature Horse Society Mini Mastery Video Education Series. I'm Janelle McCappian. I'm the Southern New South Wales show coordinator, and today I'm joined with Sascha Laurenson, who is our resident barefoot trimmer in the region.
Hi everyone.
So in today's episode, we'll be exploring all things barefoot trimming when it comes to mini horse and pony feet. But in a nutshell, we'll be looking to cover general hoof care, trimming cycles, problem feet, horse supplements and more. So Sascha, why don't you start by telling us a little bit about yourself?
Okay. Hi everyone. As Janelle said, my name's Sascha. I run a business called High Performance Hoof Care. I'm based in Goulburn, but I service an area between Goulburn, the northwest of Sydney, down through Canberra, Yass, Bungendore, etc. My main area of interest is working on rehabilitation clients, in particular horses and ponies who have metabolic disorders and have laminitis as a result. So I decided to pursue some further education, and I'm one of a handful of people in Australia who has qualification from EPC Solutions in Canada. And a lot of my training with Sylvia Corner, who runs EPC Solutions, was focused on managing metabolic horses. And a lot of metabolic horses are little, they're little ponies. And by default, I ended up working for a miniature pony stud, and I was there every week. And that's where my real love and passion of the little guys came into fore. And coupled with the specific specialised training I'd done with Sylvia, I've sort of become a little bit of an expert in managing miniature horse and ponies' feet.
Now, Sascha's going to be trimming my horses today, so you'll get to see an eclectic mix of all hoof foibles with my crew. So Sascha will talk us through each horse, what she's observing with each horse, and give a bit of a demonstration as to how she would go about trimming them.
So I'll give you guys a quick rundown on what's in my toolkit. When I'm only trimming, I only carry with me trimming tools because very often I'm out in the field, as you can see. So I want to have as light a load with me as possible. So what I always need is a hoof pick, which I hope most of you guys are familiar with. So that's just to give the foot a quick clean so that I can then see what I'm going to be working with. I have knives. So I like to use just simple curved blade, left and right-handed knives. With these, I clean up the frog and I exfoliate any loose sole. If the foot's really carrying a lot of moisture, I can actually do a lot of the trimming of the wall with my knives as well. So I carry a left and right knife. Then onto your nippers. So I have a few different pairs of nippers. These are your main nippers that you would use to go around the hoof wall. And I also carry with me a couple of resecting nippers. So these are really fine resecting nippers that I can get down into the side of the frog, or I can open up a small section of hoof wall if I need to get out some seedy toe. And I've also got a slightly bigger pair of resecting nippers where I can actually get in and take a bigger section of hoof wall if there is a white line infection in the hoof capsule. And my most important tool, and this is the one that I go through the most of, is my rasp. So I have a favourite brand of rasp. This isn't it, but it was all I could get. I would go through 2, possibly 3 a week. I like to get a really nice finish with my rasp, so I'm happy to use a few of them during the week if I need to. So this is what, once I've cut with nippers, I then go around with my rasp, and it has a rasp side, which is actually what is the aggressive side that removes material, and then you've got your file side, which is what you would finish the foot with. So this little pony, we've got he's tiny, and we've got a corresponding tiny foot. So I always begin by giving them a clean so I can actually see what I'm working with. And this is a relatively healthy foot, although it's probably a little bit elongated from the heel to the toe. But just at a quick visual inspection, there's no sign of any laminitic episode, no seedy toe, no obvious fungally infection in the frog that's going to trim up quite nicely. So for me, this would fall into the category of a maintenance trim. I'm not looking at any obvious pathology, so it's just a matter of rebalancing the foot three-dimensionally, so from top to bottom, side to side, and front to back, and removing any of this excess dead frog, trimming the bars, and just neatening up the whole hoof capsule. So I would, as I've already cleaned the foot, so I'd start with my knives. Down. The bars are clean. Just exfoliate around the toe. Only taking material that's obviously loose and is ready to go. And I always like to have a look around the heel. And just a quick swipe up the frog. Just to open it up, because the frog area is an area that does harbour a lot of fungus and bacteria. And cleaning it up and opening up the grooves here so that you can run your hoof pick. I'm just going to use my tiny resecting nippers just to remove a little bit there. So when you're cleaning your mini feet, you really want to be making sure that you're running your hoof pick up the sides of the frog, because this is an area that can harbour a lot of bacteria and fungus, and you can end up with a very infected frog. So I'm happy with just a quick tidy up. I am going to use my bigger nippers. I'm just going to take some toe off the front here, because I'm just trying to, in my head there's a seesaw in the middle of this foot, and I want half on from the middle of the foot and half to the back at the heel. So I can visualize in my head where the middle of this foot is, and I want to evenly balance it as much as possible using the rasp side. Just going to start rasping just the excess length off. So I'm happy to go down to the sole, because I know that this pony can tolerate some load bearing on his sole. I'm swapping to the file side because I just don't want to be quite as aggressive. And it gives a really nice, it removes any of the deep gouges that your rasp may cause. Just hang the foot so it's hanging loose, and I'm just looking to see, does my hoof capsule look even across the heels and fairly flat? And I can see a couple of high spots over here in this lateral toe. It's a little bit high, so I'm happy with that. Again, using my file side, I just round off the toe, and rounding off, putting a bevel on the outside of the wall just helps to prevent the foot chipping and breaking during the trimming cycle. So just a little bit of a high spot there, and because I'm a bit fussy, I might just knock that little bit of dirt out of there and there. One little nip. And one more little swipe here, and then I'm happy with the trim from this perspective. So from there, I'm going to go to the front foot. Now we're going to bring this little foot forward. So again, I'm looking at the hoof, I'm looking down the hoof capsule to see if I can see any obvious distortion, if I can see anywhere where the wall is deviating out. And again, I'm going to use my less aggressive side, I'm going to use the file side. I'm just going to continue that bevel that I've put around the bottom of the hoof to help stop any breakage during the trim cycle. And I can also see there is just a small ridge of distortion around here. So I'm just going to use my file side just to file some of that down. You don't want distortion in the hoof capsule. It's an area of weakness, and if you leave it, the distortion tends to follow, and you have a hoof capsule that continues to grow down with that slight deviation. So you always want to keep your hoof capsule as tight as possible around the coffin bone inside the foot. So that's just, it's only minor, and a lot of this today is cosmetic. I wouldn't consider that little bit of distortion to be pathological. There we go. So that, actually, no, I'm going to look there, that heel, I just don't, like, again, I can just see a little bit of distortion back there. And I'll just gently take that in. Okay, so that's a finished foot.
So, Sascha, what inspired you to specialise in barefoot trimming, and how does it differ to traditional farrier methods?
Okay, my journey down this path started close to 20 years ago now. I took on a horse that, unbeknownst to me, had foundered, and I was having a terrible time with some local farriers trying to fix her feet without actually having enough knowledge myself to know what we were dealing with. And I came across a gentleman called John Gorman, who changed my horse's life and inadvertently changed my life. I became converted to his philosophy of barefoot trimming, and over the years of John working with me on my horses, because I had quite a few over the years, he one day put a tool in my hand and said, "You need to learn to do this yourself." So not only did he save my horse, he changed the course of my life as well. And the fundamental difference is farriers trim a foot, barefoot trimmers trim a foot. But I find a lot of barefoot trimmers have a much deeper interest in the holistic approach to maintaining a horse and having a working understanding of their whole body, their musculature system, their metabolic system, their mental well-being. So it becomes much more of a holistic approach. It's not just about not putting shoes on. It's about viewing the horse as a whole. And yes, my job starts with the feet, but I'm considering the whole animal, and very often not just the whole animal, the human being that owns the animal. So it's just a more holistic overview rather than just focusing on trimming and possibly putting a shoe on. So on to Mr. Pizzazz's feet. I've already given this foot a little clean, so I'll just give you a brief rundown of what I'm looking at. Again, we've got a foot with some growth on it, which needs to come off. So this extra wall height here. We've got a frog that's potentially got a little bit of a thrushy infection going on, but I'm confident that I can trim the bulk of that material out and we'll get to healthy tissue. And I can just tell by the little tiny crack here at the toe that we've got the remnants of what was quite a nasty seedy toe infestation. So it's an infection, an anaerobic bacterial infection in the white line of the hoof wall. And if you leave these unchecked, you can end up with basically the entire front wall eaten out from the inside. So I'll just start again, same, I always start pretty much every foot the same way. I'm looking for my landmarks, so I'll tidy my bars, I'll tidy into my heel on both sides. So I'm pretty happy that that frog, even though it had some not so nice material on the top there, as I said, I'm pretty confident it's going to trim trim out quite nicely. I'd get right down deep down the sides of the frog there, right into the bottom, and clear out any dead material and any dirt and debris that's stuck down in there, because this is all going to harbour, it's a potential spot to harbour infection. And now I'm just opening up. I wouldn't normally rasp so heavy, wouldn't normally run a knife so heavily over the toe, but I wanted to get to the live sole and see what's going on with this CD toe infection. So I can see we've got a little bit of blood bruising in the white line there, so there's been a little bit of stretching, and we've just got that little remnant of a CD toe infection. Now I know that doesn't go that far up, and again from heel to toe we've got some distortion. That seesaw I was talking about is a little unbalanced in favour of the toe, and we've also got quite a lot of wall height that I'm happy to remove. So I'll start with my nippers, and we'll just go around, get off some excess height. Again, this is a horse I know quite well. I trimmed him for his previous owner before he belonged to Janelle, so I've known him for quite a number of years, and I know the parameters that he can tolerate, and he can tolerate going right down onto the sole. So I'm happy to trim all that length off. And I'm going to get to here, and I'm just going to nip almost vertically, straight up and down, just to shorten that toe, right back to the white line. And you can just see that little tiny bit of infection that we've still got left in there. So just, again, just reducing a bit of wall height. Now I'm onto my file side, just to smooth and fine-tune what I've taken off. Remember, I'm just going to look down, hold the cannon bone, let the foot hang, just checking vertically from heel to toe that I'm happy. Again, just a little rasp, a little file. I'm going to work my wall in a bit. So I'm always switching between rasp and file, depending on what I think the foot needs. And we're just getting to that little defect there where the seedy toe is. Very small, but I'm still going to use a knife and just remove it completely.
What seedy toe?
Look at that. So that's gone. So that foot doesn't need any further treatment. That little bit of seedy toe has been removed. It won't affect his soundness. So again, from this perspective, we have got some, I'm looking straight down through the fetlock, down the hoof capsule. I can see we've got some distortion down in this bottom third of the foot. I can also see we've got some ridges in the foot. These are something that you always want to be keeping an eye on. They can signify a lot of things. They generally mean there's been a change in the horse's diet or environment, or they've possibly been unwell, but they can also be an indicator that you've got a laminitic or a metabolic type episode going on. So these are something I would always take note of. I know this horse well. I know his history. So I'm observant, but I'm not concerned. I'm just going to start again. We're just rounding off that very bottom. Some people call this a Mustang roll. It's just a bevel on. It's a 45-degree bevel. It just protects that toe from chipping and flaring. It just tightens up the whole hoof capsule. And again, I just want to go around with my file, just walking in this bit of distortion that's in the bottom third of the foot. You don't really want to go any higher than that unless you're dealing with a seriously pathological foot. But you're not damaging the foot, you're not weakening the foot by doing this. It's just walking in the distortion. So from the top at the hairline to the bottom of the foot, if you sit your rasp on here, there shouldn't really be an air gap. The tighter the hoof, the closer the connection is to the coffin bone, and a well-connected hoof has a good healthy blood supply.
What signs should mini owners look for to indicate that there is a hoof issue?
Okay, so there's several several things that are fairly easy, even for an amateur owner, to identify. You're wanting to look at the health of your frog. So this frog right now, you can see there's some black in there. There's bits flaking off it. So this is the beginnings of a thrush infection. So you want your hoof care practitioner to be removing any material off the frog that is potentially harbouring bacteria, which we're just doing quickly there. Another thing that, as an amateur owner, you should be able to spot when you're cleaning your horse's feet is what this hoof wall looks like around here. So just here at the toe, I'm showing you, it's all well connected. There's no bruising here at the toe. If there was, there'd be quite an obvious red line through there. Aside from that little bit of dirt there, there's no blackness here that would indicate that there's seedy toe. All the way around here, it's all looking pretty good. So I'm happy that from this solar perspective, we're not seeing any obvious problems. You could also be looking for signs of lameness. So if your pony is obviously limping, you know that there's a problem. And very often those sort of lamenesses are starting in the foot. Once you get a little bit more experienced, you'll be able to identify if there's heat in the hoof capsule. You wouldn't do it with gloves on, but if just by holding your hand around here at the top of the coronet band, if you can feel any obvious warmth that is greater than the radiating sun onto the foot, that is a good indicator that there could be an inflammatory process going on. And again, when you're a little bit more experienced, down each side through the fetlock joint here, you can feel for what's called a digital pulse. So if you can feel an obviously bounding digital pulse on either side, that again is an indicator that there is potentially an inflammatory process going on in the foot. So these are things that over time you'll get your eye in, and you should be able to identify these things fairly easily. And they're the sort of thing that you would, depending on the severity, if your horse is limping, you'd probably want to get a vet. But little things like if you can see bruising in the toe or an unhealthy frog, they're the sort of thing you want to bring to the attention of your hoof care practitioner next time you see them.
Aside from the obvious size difference, are there any differences in the way you trim a mini horse or pony in comparison to a big horse?
There is quite a lot of difference for me in my practice. When you are dealing, basically, this foot on this pony has exactly the same number of a thing called tubules, which are just tiny little, almost like they are like little tubes of keratin that grow down in the foot. And this foot has exactly the same number of those horn tubules in it as a Clydesdale's foot. So mini pony feet tend to be much tighter in the hoof capsule, so they don't break off the way a larger horse would. So they don't really have the capacity to self-trim a little the way a larger horse with a bigger foot tends to. So I see a lot of these guys, if they're not on a regular schedule, they do one of two things. They either grow vertically and they end up looking like they're on a Coke can, or the toe grows and they'll grow up and around, which you very rarely see on a bigger horse because a bigger horse's body weight and the fact that the same horn tubules are spread over a bigger surface area, the path of least resistance is the foot will break off. Whereas with these little guys, you very rarely see the foot break off. And another issue that is prevalent in minis in particular is a process called a pain contracture, which again is related to the fact that their feet, their hoof capsule is so tightly connected. If they are having a laminitic episode and you come in and trim off the excess heel height, which is generally industry standard in a laminitic foot, you can have a pain contracture where the mini will not be able to load its heel anymore, and the heel will actually come up off the ground, and in that process your deep flexor tendon and your flexor muscles start to contract, and you can end up with a pony that can no longer put its heel on the ground. So that's something that I've seen a few times in my career. It's a devastating complication of laminitis, And it does seem to be something that's misunderstood by a lot of people in the farriery community because they just don't see as many minis as possibly I do. So it may not be something they're aware of, but it's definitely something that I consider whenever I'm dealing with a pathological miniature pony foot.
What unique challenges have you encountered when working with minis?
Okay, probably the biggest challenge I've had with miniatures, ponies and horses is a misunderstanding of their needs. They are a horse, so you do get a segment of the mini-owner community that tend to treat them like a dog when they are a horse and have the same herd needs as a horse, and they need the same boundaries with their behaviour as a horse. Very often you'll see people treating them like a backyard pet, which can make them difficult to handle and difficult to work with. But my main concern would be a misunderstanding of their dietary requirements. These guys are small. They're very prone to metabolic disorders, and very often they need to be kept off grass, which a lot of people, particularly first-time horse owners, are going to struggle with because we're all brought up thinking that horses eat grass. And unfortunately, sometimes for these guys, grass is the last thing you want to give them. So it can be very challenging for me to come in and have to get people to completely review their husbandry and change everything they're doing because their pony has a metabolic disorder and what they're feeding them is actually slowly killing them with kindness. So that can be a challenge. Very often, not the pony itself that's the problem, but just the managing the owner's expectations of owning a miniature pony. They're fabulous creatures, but their needs can differ from the bigger horses, and they're not the easy thing that some people think they are. They're still a horse. They still need their feet done regularly. They still need to be fed. They still need their teeth done. So just getting people to understand their husbandry role can be a bit of a challenge. Right, they're on. Okay, so this is my starting point. I've given the Hoof a clean so I can just have a quick look at the solar aspect of the foot, holding the cannon bone, and I'm just sighting down the limb. And the first thing I'm noticing is that we have a medial lateral imbalance in the heels. So this lateral heel is quite a bit shorter than this medial heel. So the foot is on like a 10 degree angle across the heels there. So you generally see this sort of imbalance at the end of a trim cycle when the horse has a little bit of an angular limb deformity. So somewhere in the limb, there is a slight deviation in the bony column, and the horse loads the foot slightly unevenly. One side wears more than the other. We don't fix these, we maintain them. So it's really good for me to have a good look at the foot before I start trimming and see where my imbalance is. And at the end of the trim, we don't have, the heels here are lovely and even, so we don't have an issue with a sheared heel. And again, lovely, strong. I can't move either of those heels, so it's a lovely, strong foot, probably because he's a pony. If this was a bigger horse, we might have some movement in these heels, but we don't. So it's just going to be a matter of evening up the heels and making sure that we've got this pony loading the foot heel to toe flat, or as flat as possible. All right. So I've just finished trimming this foot that had the medial lateral imbalance. Now, I've opted to trim the heels flat because I can see that we have a nice, healthy, well attached heel here. We don't have any shearing of the heels. So if I sit my rasp across here now, we're pretty well even. So this will help, even though he is going to have a slight asymmetry to the way he moves his limb when he's in motion, where this will encourage him to land flat on the foot. When I come back to trim again, that medial lateral imbalance will be there again, and we'll just keep trimming it down. So this is a preventative trim what we're aiming to do is stop any degeneration inside the hoof capsule. We don't want side bone developing on this lateral side. And we just want the whole leg to evenly share the load as much as possible. And when the horse is landing flat, that distributes the load fairly evenly up the leg. So hopefully we can stave off any long-term either tendon and ligament issues or potential things like ring bone developing over time, which is just some bony changes in the joints in the lower limb. So this is not something we fix, it's something we maintain.
Let's talk about the dreaded L word, laminitis. How do you deal with a laminitic mini's foot?
Okay. I can't stress enough to people how critical it is to avoid a laminitic episode if at all possible. But in this case, this pony has had laminitis in the past. He probably had a small amount of rotation of the pedal bone, and we have some longer term damage in this foot. On my scale of 1 to 10, this foot is fairly low down the scale, so I would rate this particular foot as a 2 to 3. So for me, it's not too bad, but we have had some destruction at a cellular level in the white line. So the white line is what connects the sole and what's inside the foot to the horn, the outside of the foot. So this should lock together like a really tight zipper. And on a healthy foot, you'd barely even notice the white line. But on this foot, you can see that we've got some stretching. So it's probably a couple of millimeters here, just at the lateral and medial toe. We've got some bruising, which is evidence of a little bit of destruction of the laminae there and some associated bruising and bleeding. And we've just got a little bit of a seedy toe infection here. So this stretching at the toe is probably always going to be something that Scorch has. I will trim that to remove as much of that stretched toe as possible because we don't want that continually getting pulled apart on the ground. But sometimes the damage to this area of the external foot is really obvious, and you can have 1 or 2 centimeters of stretched white line. And if you were to look at a foot like that on an x-ray, you would see that there is destruction of the pedal bone, which is the main bone inside. And when you start to have the pedal bone remodel or lysis, which is when the bone starts to deteriorate, they're in constant pain because the vascular system in that foot is now really damaged. So best thing you can do for these guys is to not let it happen. We're managing their diet, their weight, lots of regular exercise for them. Basically, you want to consider them to be on the verge of being a type 2 diabetic human at all times. But if you do end up with a pony that has a laminitic episode, you want your vet on call straight away. You want your hoof care professional in straight away, and you want to follow what they tell you to do to the letter because they're the people that are going to get you through. So this is a foot that, like I say, this is for me, probably a 2 to 3 on the the post-acute laminitis scale, but it does tell me that there has been damage at a cellular level. So there would be some vascular damage in this foot, and there probably is a little tiny bit of pedal bone remodeling going on in this foot.
So with a laminitic pony, how often should they be getting trimmed?
Okay, I'm going to answer that with my favourite response. It depends. If we're looking at an acute episode, so something that's just happening, and we've caught it really early on in the process, I may want to come and see your pony once a week for a period of time and just do some really micro trims once a week, just to try to prevent that vascular damage and damage at a cellular level. On a pony like Scorch, where we're looking at a chronic condition now. We're not acute, he's not lame, but there is damage. You're probably looking, depending on how fast the foot is growing, 4 to 6 weeks. 6 weeks is an ideal time frame. You don't really want to go any longer than that because you really want to keep the toe on a chronically laminitic horse as short as possible and the heels from this perspective as low as possible so you can keep the pedal bone in balance inside the hoof capsule. So it's really important with these guys that they do stay on a schedule. So there we go, I've just really shortened that toe. I've shortened this toe quite a bit more than I would on a normal healthy foot. I'm just going to, that's just dirt in the wall. That's not actually an infection. We'll just get a bit of it out.
What steps can mini owners take to ensure optimum hoof health in between trims? And are there any oils or supplements you recommend to improve hoof quality?
Okay. The thing I would recommend to most people is to actually get out and handle your horse's feet as often as possible and clean them. That way you have your eye in on what your horse's foot normally looks like. And you'll notice fairly quickly if you're handling your horse's feet every day when there is a potential issue brewing. So that's the most important thing. In terms of supplements, because a lot of minis do need to be off grass, it really is important that you either have a good high quality vitamin and mineral mix or a good high quality ration balancer. There are so many on the market now. Most of the horse feed companies are producing really good quality ration balancers. You only need to use a very small amount of the product in conjunction with a good non-structured carbohydrate-based diet. So whether it's teff hay, possibly with a little bit of loosened chaff and a ration balancer is generally all you'll need to keep these guys going. So the only time I'd really recommend any sort of topical treatment on a foot is if we were looking at treating a fungal infection in the frog, or if we had an extensive white line infection where we were soaking the foot in a product to kill anaerobic bacteria. But things like oils, if you want to use them and it makes you feel good to put something on your horse's feet, by all means, go for it. You're certainly not going to cause any harm, but there are probably other ways you could direct your money, and my suggestion would be into a really good quality vitamin and mineral mix or a ration balancer above buying topical hoof treatments.
Well, thank you so much for joining me today and demonstrating all your knowledge
You're
on my 4 minis for
very
their regular
welcome.
trim.
Very
I'm sure
welcome.
all of our members will get lots and lots of benefit from your knowledge. If anyone has any questions or comments that they'd like to make, please post them below, and Sascha and I will do our best to come back to you as quickly as possible.
Looking forward to hearing from some of you. I hope that you got something out of this.